heart and peripheral vessels. Okay, let's start with the neck vessel. So we inspect the jugular vein. Okay, so we ask the patient, or we position the patient with the head at about 30 to 45 degrees. Okay, so Princess, can you please face it? Okay, come over here. How will you see? Okay, so the sternocleidomastoid muscle stretches from here, if you can see this area here, all the way there. So anterior to that, look at that. Can you see it? Mm-hmm. So the pulsation goes. So that is the carotid artery. Now look at this pulsation here. Look at it very, very clearly.
It's a jugular.
Okay, let's go. You see it? Okay. So this is your jugular vein pulsation, and that is your carotid artery. Okay. So we're looking at it, we're seeing it right now. Okay, it's faint but visible. But as we ask the patient, can you sit up? Please don't sleep. Okay. Okay. And look at it now. You will see that what is going to be very prominent is the carotid artery pulsation. You see, it just goes that.
Mm-hmm.
It no longer, you don't see that anymore because it disappears. Okay. Now we measure the pressure, the jugulus venous pressure, like I said. Okay. Ask the patient, can you turn again towards your left? We feel for the sternal notch because the landmark that we will use here will be the sternal angle. Okay. So this is her sternal angle. I will put this ruler here by the sternal angle. Okay. And I don't have any other ruler, so I will use a tongue blade. Okay. I will observe for the highest point of highest pulsation of the jugular vein. So it's about here. Okay. See? Okay. And then just use the tongue blade, okay, to mark that spot and see where it lands over by your ruler. Look at it. Alright, you see it? So it's about an inch. Okay. So that's 2.54 centimeters if we have to convert. Now, we have to add 5 centimeters to that. Okay, that's a standard. And so we now come up with a 7.54 centimeter. And we said the jugular venous pressure is less than 9. So that is normal. What is that 5 centimeters that we add? That actually reflects the distance of the right atrium from the sternal angle. Okay, so that's why we add that 5 centimeters. Okay, so basically, the jugular venous pressure of our patient is normal. Okay, any questions? Okay, then we now auscultate the carotid artery, and we said we need to use our bell. Okay, bell. For the brood. Yeah.
BB.
Okay, so if we're listening to the bruit of the left carotid artery, we ask the patient to turn to this side. Okay. Now, can you please take a deep breath and hold? Okay, relax. Good. Now, please turn that way. All right, relax. Okay, so no bruits are heard. Now we will palpate. Okay. When you're palpating the carotid artery, you can actually compare the pulsation to the radial artery. Why? They have to have the same timing, the same pulsation. When I say same pulsation, the timing. Okay, so when this goes, you also feel this one as a, okay. Why? Because if we don't feel the same pulsation, or one seems to be lagging than the other, that's a pulse deficit. That's what we mean. That means one of the arteries has a narrowing. And the artery that has or the pulsation that seems to be a little slower, okay, let's say it was here, then that means your artery towards this radial artery, or the major artery that leads to the radial artery, has a narrow. Okay, so hers is the same. Okay, now is that yours?
No, it's you.
Can you turn to this? Okay, so that is for our palpation of the carotid artery. We do not palpate at the same time because we will be stimulating the baroreceptor reflex. Patient going to faint. Okay, now we will identify the parameters. So like we said, we identified earlier the angle of Louis, correct? You have your second rib, so from the angle of Louis, move your fingers a little to the right. You'll feel it, that's the second rib. Below it will be the second intercostal space. You also have the mid-clavicular line, that's on the left. Okay. You also have the anterior axillary line, and you have the mid-axillary line. Okay. So we now identify the and inspect the cardiac areas. So we have over by the second intercostal space, right sternal border, that's the second ICS, right sternal border, that's the, what cardiac area is that? Aortic. Aortic. Second ICS, left sternal border. Pulmonic. Okay. Third ICS, left sternal border. I drank so much water. Okay. Third ICS, left sternal border. Herbs. Okay. And then you go inspect the fourth ICS, left sternal border. What else did you miss? Tricuspid. Okay. And then you have the fifth ICS, left mid-clavicular. Okay, that's the mitral. Okay, so these are the areas. So if you look at the areas, okay, the only area where you will see a pulsation will be by the PMI, by the fifth ICS, left mid-clavicular line. Okay, if you have an individual with a very thin chest wall, you may see the pulsation here. It will be reflected back towards the upper chest wall, but the pulsation is mainly from that area. And you will be able to confirm your, what you saw by your palpation now. Okay, so you palpate again, second ICS, right sternal border, aortic. Second ICS, left sternal border, pulmonic. Third ICS, left sternal border, herbs. Fourth ICS, left sternal border, tricuspid. And you have fifth ICS, left mid-clavicular line, mitral. Okay, and you will be able to feel it. Okay, so here. And it's a dime-sized area. So if you're able to, when you're palpating and you feel it all the way here, or all the way up, or, lower down, that means there is enlargement of the heart. Okay. Now we will, so that's for our palpation. We move on to our auscultation. Okay. So we said that S1 is produced by the closure of the AV valves, which are the
mitral.
I know atrioventricular, but which are those valves?
Tricuspid and mitral.
Okay, tricuspid and the mitral. So basically, do we use our bell or our diaphragm? The diaphragm for the S1 and the S2. Okay, those are normal heart sounds. Okay, so we said because the S1 is produced by the closure of the mitral and tricuspid, which are the AV valves. Okay, we hear it louder in this area, the fifth ICS, left mid-clavicular line, and along the fourth ICS, left sternal border, the tricuspid and the mitral areas. So here you will, these areas, you will hear S1 coming out as lub, lub-dub, lub-dub. I want you to listen to it. I want you to be able to appreciate it. So you don't say, oh, she says it's like this. You listen very well to it and you will be able to appreciate it. Okay. And then we have the S2, which is produced by
aorta,
the aortic and the pulmonic, otherwise called, if we have the AV valves, what are these called? Semilunar. Okay, so you have the semilunar valves. Okay, and we said they're heard best over by the second ICS right and left sternal borders. Okay, so in these areas, the sound will be lub, lub, dub, lub, dub, lub, dub. Okay, it's not going to be as loud as my voice, but it's going to be the sound will be louder or will be more emphasized with the dub. And then over by the herbs point, that's where you have lub, dub, lub, dub, lub, dub, lub, dub, lub, dub. Okay. Now, here is the thing. When we're doing our auscultation here on our patient and when you do your exam, I know that, you will be using your stethoscope on top of the shirt. Okay. It will not be in contact with the skin. But, ideally, when you are assessing your patient, okay, your stethoscope, whether it's the bell or the diaphragm, should be in contact with the patient's skin. Okay, that's why you just use an alcohol pad to clean your diaphragm or bell. Okay, please keep that in mind. Don't, you look at the doctors, they go, oh, take a deep breath. You don't even know if they're really hearing what you're supposed to hear. They go, oh yes, I hear it. But they miss murmurs, And if you have seen cardiologists, doing their thing, they really are able to, put the stethoscope in contact with the skin. Okay, so may I?
It's not faster than that. Let's take a cardio.
I will close my eyes because all I see is like phones coming at my face.
Okay, so during the exam, you have to show me, these different cardiac areas. You have to auscultate those areas and tell me whether you hear S1 louder, S2 louder, or equally loud. Okay, so that is for S1 and S2. Now for S3, because these are abnormal sounds, like I said, you will not need to use your bell unless you hear an abnormal sound. So I did not hear any abnormal sound from her, so I don't need to, look for an S3 or an S4. We always say, if you're able to appreciate an abnormal sound, that's the time you use your bell. Okay. If your patient, if you're not able to appreciate it very well with the patient in a supine position, ask your patient to turn to the left. Okay. Now, we will palpate the brachial artery. Okay. Nerves are very strong. Okay, so they're bilaterally equal and strong. And then we now you need to take the BP on one arm. Okay, and then we inspect and palpate the upper extremities for color. Okay, so again, you look at the pinkish undertones. You may be able to appreciate the veins that's running through her skin. Okay, skin is intact. You see there's hair. Okay, that's scattered, fine hair scattered all over. Okay, now we also assess the temperature. Okay, so it's warmer on the arm, cooler on the fingertips. Okay, now we assess the radial pulses. We said it's the one that is along the thumb. the ulnar pulses, you know where it's at, but seldom are you able to appreciate it because it's a very small artery. Okay, and then we now assess we now perform the modified Allen test. So, Princess, please, yes, several times. Okay, now keep it closed. I will compress both radial and ulnar. Okay, open. See how it's blanched? Okay, I will release the ulnar. You see the flow? Okay. Did you feel the, okay. So you keep the pressure on the radial artery because you're trying to, elicit like an arteriospasm like, what they call this feeling here. So if there is that reddish, return of the reddish flow to the palms of the hand as well as the fingers, that means there is good collateral circulation. Now, if that is a positive modified Allen test, if that is not positive, then you'll have to test the other hand. Okay, because that means this you cannot use for arterial blood gas collection. Okay, and that's the most common site. Okay, now we also do our capillary refill. Oh, you may need to take off your socks.
Okay. Oh, you were lucky I took my nail polish off yesterday.
Okay, so you have the quick return in less than 3 seconds of the pinkish color to the nail bed. Okay, then we do our shamroth, please. Okay, so you see the 160 degree. Okay, is it convex, concave?
Convex.
Convex. Good. All right. Now, we do our inspection and palpation of the legs. Okay?
Want me to take them off?
Yes, please.